is recognized for 2 minutes.
Thank you, Mr. Speaker and Mr. Chairman. I rise in support of this continuing resolution package. While I appreciate this legislation will keep government open, fund community health centers for 2 years, and fully fund our military while we continue to work toward a broader budget agreement, I would like to focus on the various Ways and Means Committee provisions included in the bill. This legislation includes numerous Medicare provisions important to rural health providers and patients, including permanently repealing therapy caps and extending the floor on geographic payment adjustments for rural providers and add-ons for rural ambulance providers. Just as importantly, these health provisions are paid for without cutting swing bed reimbursements to critical access hospitals, including the 55 critical access hospitals in Nebraska's 3rd District as originally proposed. I'm particularly pleased 2 important improvements to programs within the jurisdiction of the Subcommittee on Human Resources, which I chair, are included today. We have much work to do to lift Americans out of poverty and into prosperity, and each of these bills will play an important part in that effort. The Family First Prevention Services Act reforms our child welfare system to reinforce the importance of keeping children with their families whenever possible. We know children who stay with their families have better long-term outcomes than those who move to non-family settings, and our goal for every program in this space to demonstrate results through empirical evidence. I want to thank the sponsor of Family First, Mr. Buchanan, for working to address my concerns about nurse staffing requirements, which would have been costly to implement for entities like Omaha-based Boys Town, while providing no tangible improvements to their family-driven model of care. The other HR item in this package, the Supporting Social Impact Partnerships to Pay for Results Act, also moves our family support programs to a more results-driven model by incentivizing states and local governments to pilot new ideas and reserving federal funding until they demonstrate outcomes through rigorous data-driven evaluation. We still have more work to do in this space, starting with completing the work begun by this chamber last September when we passed a paid-for 5-year McVee reauthorization. But like the rest of this legislation, these provisions are a down payment on the work we are committed to.
Please to yield the gentleman another 30 seconds.
The gentleman from Nebraska is recognized for 30 seconds.
I thank everyone. I thank the gentleman for the time, and I certainly urge passage of this bill, and I yield back.
Nebraska yields back his time. Gentleman from New Jersey.